Okay, today we're going to talk about standard steps for all nursing procedures. Anytime that you're going to do a nursing procedure, and that can be starting an IV, starting a Foley, doing a straight cath, doing a dressing change, whatever procedure you're doing, we have certain steps you need to do. And the first steps are A, B, C, D, and E. A is, do I know how to do this skill? Review those steps mentally. Ask your instructor questions, or both hospitals have a procedure book that you could look the procedure up in. Next is B, gather your supplies. What do I need to take to the room with me? You're going to go to the room, knock on the door, phone in. C is go in and introduce yourself. Make sure you've got the right patient, and that's by 2-patient ID. Explain the procedure and educate them. Ask them if they've got any questions. Have you had this done before? Did you have any problems? D is provide privacy. We always want to protect their dignity. If you need to raise the bed, raise it to a good working height. Arrange your supplies. Do hand hygiene. And if you need to put on gloves for this procedure, put on gloves or any protective equipment. If you're going to get splashed, then be sure you put on a gown and a mask. And finally is, when you're all done, you need to make sure that you've done it in the correct order with an aseptic technique, and tell him when you're finished. Now, your steps after the procedure are, you want to leave your patient clean and dry. You want to dispose of any used equipment. And of course, anytime you take off gloves, you're going to perform hand hygiene. You're going to give the patient back all of the stuff that he had. His water, his telephone, his call light, his Kleenexes, anything that he needs to make himself comfortable. And you need to pick up all of your old trash, soiled linens, and take them out with you. And then once you're out, you need to document.